has been, and you can see this is a very beautiful place and very conducive for all those works that we are doing. Thank you very much. We appreciate you every day that we step on this campus. The list is long for us to appreciate, but permit me appreciate the Board of Trustees, the various executive directors. We have some former chairs of boards, and allow me at this juncture again to appreciate Honorable Justice Kavuma. He's one of the board chairs. He contributed. Right Honorable Amambala's, he was also a board chair. And my the person I replaced, Professor Epero Pio, is here also. These people have done a great job, and we appreciate them with a lot of gratitude. But also our executive director, Professor Mujenyi, we have to thank you again and again, because what is here was out of your hard work. But also on behalf of the board, we have to thank the partners and collaborators, many of whom are still working with us. And most importantly, our patients. The patients are the reason why we are here. And they have played a very big role. Those who are present, and of course those who are not. We thank them so much. And I want to thank all those, whoever has made a contribution in these 30 years. Thank you so much for the great contribution towards Jcrc. But Your Excellency, allow me also to thank the current board. And we are a board of 9 members. I would like to introduce them. I'll begin with the board secretary, Richard Masereje. He's here with us. Dr. Musinguzi from UPDF, here with us. Ben Okelelwum, one of our long-serving board members. I think those are the ones who are here present, but we have a very strong and united board. And that's why you see we continue to grow. The strategies we come up with are very strong, and we have a very good implementing management. And all this, Your Excellency, has made Jcrc a great organization, because today Jcrc is ranked the best research organization in Uganda. We have received a number of awards on that. It has one of the best medical and research scientists that you have in this country, and one of the best finance management teams in the country. We have got awards to attest to that. And Your Excellency, I take this grand opportunity to extend my felicitations to you, of course, to the Minister of Health, Minister of Defense, and Makerere University College of Health Sciences for the invaluable support, guidance, and direction that has made Jcrc to grow into a world-class center of excellence. My deep appreciation to management and staff in the last 3 decades, to the great contribution and for translating your great vision into what Jcrc is, and for delivering on the mandate to which it was established. Ladies and gentlemen, HIV continues to pose a big challenge worldwide, but especially here and other sub-Saharan African countries, and even other low and middle income countries, because there is no cure in the current times. Our patients must continue taking antiretroviral drugs on a daily basis. It is, however, appreciated that the drugs are very effective to the extent that blood tests may not even show presence of the virus, and these patients are able to live longer and healthy lives with the virus still hiding in their bodies in HIV reservoir cells, meaning that even when they are enjoying, the virus is still there. And that is a very great concern for us here at the board of Jcrc. There are cases where one is not able to continue on drugs. The virus then wakes up and becomes even more strong. Therefore, we at Jcrc understand this very well, and the Jcrc board has laid down a number of key strategies to end this scenario. And we are doing all things possible to support our scientists, together with our partners that you've seen, some of them, to come up with an HIV cure product. This may come soon or later. Your Excellency, this is therefore to seek government support for the various initiatives that have been put in place to end the HIV scourge through gene therapy, a project you have just unveiled, and vaccine development. The ED, the Executive Director, has informed you about the grant that we have just won. So we want to put all our efforts to develop this vaccine. But we also want to treat and cure sickle cell anemia using bone marrow transplantation and gene therapy. As we speak now, to do a bone marrow transplant in India for sickle cell anemia or any other blood disease, the cost of the procedure alone is from $20,000 to $60,000 United States dollars. This is without transport, without food, without hotel. This is a lot of money for an ordinary Ugandan. And also to do gene therapy for a patient, and we have had some Ugandans who have gone to the US to have that done. The process is between 1 to 5 million US dollars. Just imagine what a save that would be to do it here. Therefore, we are very excited, Your Excellency, that today you have come in person and you have launched a landmark project in the region, the first of its kind in sub-Saharan Africa. Your Excellency, we are very grateful for the support you have given to Jcrc. We will keep thanking you, but again, over the years, but as you are aware, we must recognize and be very mindful of the enormously high costs it takes to develop these innovative therapies that will improve our patients' lives and avail treatments locally that would otherwise never happen. And for us here at Jcrc and at the board, we think now is the time. The scientific initiatives require huge investment, but the return on the investment is very worthwhile in all aspects. This is the reason we can never stop calling on government to help where the need is felt. Your Excellency, at the moment we have built and strengthened our human resource capacity, and like the ED said, they are being eyed by many other organizations, but we don't want to lose any of them. To achieve this, we must continuously improve their working conditions and give them other incentives. In the same vein, Your Excellency, I know the ED talked about it, but the Jcrc board also feels that the Jcrc circle, which was started humbly, and we humbly request Your Excellency to support this circle. I'm pleased to say it again. But in addition, Your Excellency, I would like to appeal to you to find another urban model of the parish development model for our low-income earning staff, who, so that they too can benefit from the parish development model to improve their livelihoods and contribute to the economy. Your Excellency, ladies and gentlemen, I'm winding up. I know I have pledged a lot that Jcrc can do and contribute to provide prevention and treatment of a number of diseases. On behalf of the board and management, I understand that it takes high level of dedication, innovation, excellent teams of scientists, excellent infrastructure, and a supportive, peaceful environment that government has provided to be able to attain our desired goals. This will enhance Jcrc's capacity to continue to play a leading role in national development through research, through innovation, through product development. We are not only thinking of services, but we want in the shortest possible time to give you products. The ED talked about one of the products, but in the short run we shall give you more products. But we shall also endeavor to do patient care to reduce government expenditure for treatment abroad and to ensure good health for our population as we also engage in solving other societal problems. Your Excellency, in conclusion, I thank you very, very much. I want to thank all our guests. I want to thank the Jcrc board and management for organizing these celebrations, our partners who are here, well-wishers, even the media and fellow Ugandans for responding to our invitation. I pray that God blesses us all, and may God bless Jcrc, and I wish you nice celebrations as you stay here. I say all this for God and my country. Thank you very much. My name is Professor Charles Sibinjira, the Chair, Board of Trustees of Jcrc. So thank you so much for listening to me. Your Excellency, may I take the singular honor to invite my colleague, the Honorable Minister of Health, Dr. Jane Luther Cheng, to come and address us. Thank you very much.
Your Excellency, the President of the Republic of Uganda, allow me to cut short the protocol because of your very short time here and say all protocol observed. Your Excellency, I thank you for taking off time from your busy schedule to come and celebrate 30 years of Jcrc. Congratulations, Jcrc, we are proud of you. As we are all aware, the first case of HIV/AIDS was identified in Uganda in 1982. Your Excellency, through your leadership, awareness and preventive messaging was conducted early as soon as the epidemic was identified. And the Ministry of Health established sentinel sites that were used to monitor the trend in the HIV prevalence, which reached a peak of 30% in Kampala by 1992, but with no available treatment. Allow me to appreciate you, Your Excellency, as many others have said, for establishing this great institution, the Joint Clinical Research Center, which you started in 1992, aimed at finding a scientific solution to HIV, then known as slim disease, which was a major health problem to the Ugandan population. We may recall that by 1991, the life expectancy in Uganda was 46 years, and 1 out of 10 children orphaned to HIV/AIDS. And quite often, it was loss of both parents, and by 1992, 56% of admissions to a general hospital in Uganda were due to HIV/AIDS, and 52% of the deaths were attributed to HIV/AIDS. Your Excellency, ladies and gentlemen, we are all alive to the fact that by this year, 2023, according to estimates by the World Bank, the life expectancy in Uganda has improved to 65 years. The annual number of new HIV infections is 52,000, and out of the estimated 1.4 million people living with HIV, approximately 95% are on treatment with antiretroviral therapy, and close to 95% of those on treatment have achieved viral suppression, which not only improved the life of the individuals, but also reduces the transmission of HIV. Uganda has one of the youngest populations in the world, at an average age of 16.3 years. And most of the new infections are occurring in the young population, which also has a lower treatment adherence and a lower viral suppression than the older age cohorts. The average HIV prevalence in the country is 5.5% among people aged 15 to 49 years. The improvement in the HIV statistics in our country has been achieved through a multi-sector approach and in partnership with our development partners. The Joint Clinical Research Center has made significant contribution on each step of the journey towards ending HIV/AIDS as a public health threat, and we expect it to make a significant contribution in the last mile of this journey in ending AIDS by 2030. Your Excellency, Jcrc has provided treatment to over 100,000 patients on antiretroviral therapy and currently provides treatment for close to 15,000 patients in Kampala and Wakiso, as well as supporting treatment for close to another 100,000 patients in northeast and southwestern Uganda in the region supported by our partners, USAID. They also support programs in Kigezi and Lango sub-region. As we move to the last frontier in the cure of HIV, Jcrc is again at the forefront of efforts to find an effective HIV vaccine and to ensure that Ugandan scientists actively contribute to designing the research for the HIV cure, especially through the emerging cell and gene therapy technologies. Gene therapy approaches uses the patient's own blood cells to treat the HIV, and clinical trials have already started in the United States of America, as you heard from the executive director. These cell and gene therapy technologies not only treat HIV, but have the potential to cure other diseases, including sickle cell disease, hemophilia, and even some blood cancers that are not responsive to other conventional treatments. Thank you, Your Excellency, for commissioning the Bone Marrow Transplant Center and unveiling the construction of the gene therapy unit. The Ministry of Health strongly supports Joint Clinical Research Center in attaining its objectives, because a cure will be far more important than the current lifelong treatment, which can fail if not taken adherently. As I conclude, I wish to take this opportunity to congratulate Jcrc again for the past and current work and the achievements of 30 years of existence. You have been strong partners in our HIV research and treatment programs, which are important components in the HIV prevention strategy. In addition, allow me to appreciate our partners, including PEPFAR, the Global Fund, the UN family, among others, for their continued support and collaboration with the government of Uganda in the fight against HIV/AIDS. Finally, allow me, Your Excellency, in a special way, to thank you for spearheading this fight against HIV in Uganda and your commitment to end AIDS by 2030. Your continued support to the health sector and your vision to have a healthy and productive population that contributes to socio-economic growth and national development. Thank you very much for listening to me. I will be coming back to invite His Excellency the President.
Thank you so much, Honorable Minister. So at this point in time, we also want to recognize the presence of Uganda Virus Institute. Thank you so much for coming, and CPHL, and also the ED from Lago Referral Hospital, Dr. Byanyima. Thank you so much for gracing this occasion. So we'll allow Your Excellency to accord recognition and award for people who have supported Jcrc in different categories. And one of them is going to be the founding member, Professor Manfred Dietrich, who provided the first instrument in the lab. We want to really recognize as who supported us to the start of this institution. We're also going to recognize the former Jcrc board chairpersons, the people who have really spearheaded and given direction to management in different capacities and different periods of time. One of them is going to be the Honorable Patrick Amamambabazi as our second board chairman, Honorable Dr. Crispius Chionga, our third board chairman, the former Justice Stephen Kavma, the fourth board chairperson, and Professor Justin Eperu, Opio, the fifth board chairperson. We're also going to award one of the long-serving board member since 2022. Since 2020, Mr. Ben Rumu is one of the longest-serving board member. He's also going to be recognized. And the past executive directors, Professor Mbonye and Professor Peter Mjenyi. Yeah. So I'll read. You can kindly come forward, Peter Mjenyi. Honorable Crispius Chionga. Please. Chief Justice Stephen Kavuma. Professor Justin Eperu Opio. The past EDs, kindly get ready. Professor Mbonye. And Your Excellency, also we are awarding the long-serving partner or collaborator. Since we started, Case Western Reserve University has been with us. And Immaculate Nansha, you're going to represent and receive this award. Case Western, please come. Professor Eric Arts, kindly come forward. They will take a photo moment. Yes, we stand, please. Please kindly get forward in the interest of time. Professor Mama Mbabazi. Yeah, Dr. Ben. Right, Honorable Mama Mbabazi. It is okay to be a professor too. Yes, he's a professor in many ways. Yes. Who is that? Kindly. Ben? Yeah. Dr. Mbonye? Mbonye? Not yet. Okay. Mr. Luumu? Thank you so much for serving Jcrc for all this number of years on the board. I'll request the minister to join the photo moment, plus the ED and the chairperson.
Ladies and gentlemen, can we give our award recipients a round of applause? The three categories, the former chairpersons, the former executive directors, and of course, the partners who have been recognized and are here to join Jcrc in celebrating 30 years of research, innovation, and a lot of work done in improving the livelihood, the health, care, and livelihood of our people. So we want to thank you, all the stakeholders who have been with us through the 30 years. And this was a very small token from the Jcrc for yourselves to be able to have in your homes as recognition for your support and the role you've played in the 30-year journey of the Jcrc. So we want to thank you, and that is the photo moment with His Excellency the President and the Jcrc staff. Can we give them another round of applause? Your success you're celebrating is thanks to this great team that is before us for having led the way in this 30-year journey. So we want to thank you, the former board chairpersons and the former executive directors and our partners for supporting Jcrc at 30. Thank you so much. Honorable Minister, I see you're very physically fit, so in 30 seconds you will be here to invite our chief guest to address us. So, Your Excellency, your health minister is very fit. She has been reached here in 15 seconds.
Your Excellency, it is my honor and pleasure to invite you to address us.
The Honorable Minister of Health, the Chairperson of the Board, and board members, all the partners, and the scientists and staff of Jcrc. First of all, congratulations on the 30 years. Secondly, I want to thank Mr. Muturuza for not harassing Sise. So that she does a good job here, which she has done. Thirdly, you can see that women have got a streak of dictatorship. Sister has ordered my office to fix a meeting for her. But in order not to have a war, I totally agree to the meeting. Now, your languages are rich, so they describe events better. When you are starting a fire, we call it in Runyankole, Okhemba Murro. That's when you light the fire. Then the fire must be maintained. That phase of maintenance is merged with the starting. This is all Okhemba. But then there is, in Uganda, the Okhemba would be Okuma Muriro, Okuma Omuriro. But then there is, in Uganda, what they call Okse Samu, Okwenejeza, to make stimulate the fire when it is a bit declining. So you people, some of us did the Okhemba, starting the fire, and you people have been very good in maintaining, but also in Okse Samu, Okwenejeza. So I thank the staff, the executive directors, the board members in the last 32 years for maintaining this fire, but also expanding it, because we are now doing new things different from the original limited mandate which we started with. So I thank everybody. I am surprised that we have taken so long to get a vaccine, because when we attended the AIDS conference in Florence in Italy, I don't remember which year it was, there was quite a bit of optimism that we would get the vaccine. Even me, I was almost becoming like a molecular biologist. I was following very closely, because that time we were saying that the problem is that this AIDS virus mutates, that it changes. But then, as people are saying, although it is mutating, some portions of it don't change. And if we can capture those, then we could get a vaccine, we could get like a common denominator in the variants of the virus and fight and recognize it. Then later on I heard that no, this was very dangerous, because it enters your own defense system, and that's why it's not detectable. What is the latest? Now you educate me about what's happening now. What are we doing about this enemy who I thought would get a Kaliva, the Kasumaloka skin? What happened to that theory of the common denominator in spite of the mutations?
Your Excellency, that theory is still being evaluated. It has not gone away. That is one of the strategies. But we are also looking at the strategy of gene therapy, which can actually go and cut out the areas in our DNA where the HIV has inserted. So gene therapy, again, that's why we are saying we have to be involved and engaged as a country.
Akaliba. Yogera murwafe.
HIV, I will speak in English, Your Excellency. The HIV, of course, has different... The HIV has, as you have rightly said, you have actually become a molecular biologist. There is a common denominator, which is the core of the virus. You know the core, the virus is, it has a core, ebyenda. Then it has the cover, which we call the envelope. And that envelope changes with the different HIV subtypes. But this core, which has elements that are common across the different HIV subtypes, is one of the areas or strategy we are looking at when we are developing HIV vaccines.
Why has it taken so long?
That is a good question. This research has been done exclusively in the West. Let me answer. Stand there. So why has it taken so long? This other scientist is from Uganda Virus Research Center. She's actually... But also why it has taken so long, Your Excellency, one of the reasons which I can say here is all this work has been done exclusively outside of the region which has the highest HIV problem.
Oh,
yes. So now... But
Thank you, Dr. Sisi, for the opportunity. The Uganda Virus Research Institute has been involved in HIV research funded by USAID through International AIDS Vaccine Initiative for about 18 years now. And I've been part of this research. I started as a postdoc for about 7 to 8 years now. The research, that the challenge with the previous approach was because we were looking at viruses that are in the entire quasi-species of an infected individual. That is the swarm of viruses that exist in an individual. However, as research progressed, we realized that out of those quasi-species, there are these unique viruses. It's either one or two that have the unique ability to set up a successful infection in the recipient. So those are the viruses that we need to target for successful vaccine development.
Linda Komwara. Kati ogamba nti obuwuka bwa siriimu obulumba omuntu waliwo obugenda abanyankole bulikwete okukanya to increase in number ate ne wabawo obutakwiza okukanya
kakati obuwuka buba bungi bwa type nyingi
naye bwasirimu
bwonna bwa siriimu naye bwonna tebulina busobozi okukola successful infection mwoli abakafuna
okuyingira mu butafaali bwaffe.
Exactly. Kati olaba vaccine erina kutagetinga buli obulina potential okuyingira. Kati ekyo twakizuula along the way. Then to add on to what Dr. Sisi said, also
omwana wamwita nono amanya
But Dr. Sheila Balinda, Your Excellency.
Balinda, I've met you before.
Yes, I'm also involved in the vaccine development for COVID-19.
Oh, okay.
Yes.
So now, for Baganda, of Africa, tukozesa ebigambo esuubi weeriri.
Esuubi weeriri.
Ah, Katonda yeebazibwe.
Yes.
Thank you. Thank you. Kati, your Banyankole have got very bad proverbs. There's one which I would want to make, but I fear to make it here. But naendo was mu Luganda, waliwo olugero olugamba nti nannyini mufu yakwata awasinga okuwunya, si bwe kityo? So what these young people are saying, what Dr. Kitio and the young girl are saying, is that buno obugayaavu obw'okulekera abalala be baba tutaasa ndowooza ekizibu yekivudde. Not doing the research ourselves and letting others be the one to do the research is part of the problem, because they don't have the same pressure like we have with our local problems. So I'm glad you are working up, because me, I didn't think that it would take so long. When we were in Flores, I didn't think that it would take so long. But anyway, it seems that you are working up, and we really must get a vaccine. So I'm very glad with what Dr. Kitio is doing and her staff. And the other people because you know how much these vaccines can solve problems. In the other century, we had a very bad problem here of smallpox, kawali, omuze, they call it in our languages here. It killed a lot of people in 1893. Many people died during that epidemic of the smallpox. But when the vaccine was introduced, everything it disappeared. I don't think that smallpox even still exists now. So therefore, I challenge the scientists, especially our own scientists, to wake up and to deal with these problems instead of just sitting and waiting for others to do the work. I congratulate Jcrc for the bone marrow transplant center, which we have just opened here. Omshokoro bobaita, that's how they call the bone marrow. Muluganda bakita omsomyo. So Dr. Kitio has educated me how they are going to do it. And as Professor Vinjira was saying, when it is done here, it will be much cheaper than when you do it outside. I therefore congratulate you on that. And now the gene therapy, okutokora. You know, bw'omwogera oluzungu mumubula ate oluusi oluzungu teruggyayo bulungi ebigambo. So by editing some of these genes which are susceptible to this or the other one, so now the editing, she say, when you edit out, can you also add or what?
Your Excellency. Excellency, you got it right. You can
either
subtract,
or add.
you can add, or you can silence.
Okay,
Yes.
very good. Kati mugambe abantu bamwe bwe twaleeta ekiteeso waliwo okusukangana omugwa n'abanaddiini. Nsanyusa okulaba nti abanaddiini wali wano, abanaddiini bagamba nti mwegala kwefuula nga Katonda. Ne batusanyalaza, tukyasanyaladdemu. Abanaddiini mugamba ki bannange? Abanaddiini abo badde wano mujje ku muzindaalo tubale bye mugamba. Kubanga abanaddiini twali tugenda okuyisa tukiyita biotechnology, ne bagamba nti mbu twagala kwefuula ba Katonda. Okutonda omuntu, okutonda kino, okukola ku butonde, tuba tususe ensalo. Abanadini, have you heard of that? Those who are here, or you don't have the mandate, but here, they fear the bishop and Kambaleke, let me not embarrass you. What I'm saying, in our local language, we had some discussion with our religious people who thought that biotechnology and genetic engineering was interfering with the work of God. So we are trying to persuade them that no, we have been doing it for a long time. I have been a genetic engineer for a long time, all my life, because we the cattle keepers, we always select the good breeders, a good bull which will produce more milk. There are some bulls which produce only females. We the cattle keepers, we are the only people who appreciate females more than anybody else. If your cows are producing male bulls, then you are very unlucky, because what do you do with the bulls? But if they are producing female, they are good because you have a bigger breeding population. So I would want to convince my religious people that we are doing that. We would select the breeding bulls because of the performance criteria of those bulls. So we are doing engineering, but using the slow way of aggregating these genes. Now these scientists, because they have the chain, the whole chain of the genes, they can see it, and they can know which one is causing problems and deal with that one. Just like we are doing it by breeding, it can now also be done by we are editing, actually we are doing the same, but doing it through the breeding method. Now they want to do it through this laboratory-based method. So it's not really a new, it's not a new practice, but it is a new way. I don't know whether, how you would respond to that, sister. How do you, my thesis, is this correct or?
Your Excellency, you were doing genetic engineering or editing the Kinyankole way.
Now, the science way, Eliatia.
The science way is, as you already mentioned, we have to know the sequence. First of all, if it is HIV, we need to know the sequence where HIV inserts in the DNA of our genetic material.
Gyetera okuyita. Obuuka gyebutera okuyita.
Gyebutuula nga butuuse mu mibiri gyaffe. Ne tunoonyaawo ne tumanya nti bwe tunaaweereza gene therapy yaffe wano wejja okusala egatte
tebugenda kufuna omulyango
butereevu.
Very good, very good. Webale nnyo. So I congratulate you people for forming your circle. Okwegoboka obwavu. Nange ngenda kutunda ennumu zange nteekemu obukadde 10 mu circle. ate kaweefube wa nakandi ngenda kuteekamu obukadde 3. Those are a few words in our French here. You know, we've got our own French, which people outside may not understand. Now, finally, I want to thank our partners. I was listening carefully. I think you are very careful people, because you had not mentioned the name of Professor Jcrc. But I remember very well, Professor Jcrc is the one who came and told me about this. Does anybody remember what exactly happened? What did Professor Jcrc say and do? Who knows? Who knows the story? Because I remember Professor Jcrc. Sise.
Doctor at the time that this institution was being established, but I've heard the story from Professor Jcrc, and it's unfortunate he's not here, but his award is here.
Yes, because he's the one who brought, he had worked in West Africa, he knew something about Africa, then he came and told me that he's the one who brought the idea to me. And then I supported it. And then you say he contributed the first equipment, or what?
He contributed the first equipment in the lab. That time Professor Mjenyi was our boss.
No, the starting.
Yeah, he contributed.
Professor Mjenyi, can you tell us if you remember how we started?
Thank you, Your Excellency.
What was Professor Jcrc's role?
He did 3 things, Your Excellency. First of all, and most importantly, he was concerned about people being sent to Germany, to his clinic.
Oh, they were going there, he saw them there?
Yeah.
And decided to come and see where they are coming from.
He said, let me go and see President Museveni to do it in Uganda. And in doing it here in Uganda, he contributed the equipment.
He needed some equipment to do what they were going to do outside there.
Yes, so that people from there onwards stopped going to Germany for those tests which were being done there.
Yes.
And he also sent people, I think you know Mr. Tugume, he invited him to go to Germany to learn the very first technology for CD4. And Tugume is the grandfather of Ugandan technology in introducing new CD4 technology in the country, which we spread to all regions of the country.
Where is this Tugume?
He is now...
Come and tell us, come to the microphone there.
Yeah.
Because you must get the story correctly.
Yes.
Tugume
is continuing in teaching other young people the lab technology, and fortunately is here.
Tugume, what are you?
Your Excellency,
One, I'm a medical technologist. I was, at the time, working with the Army. I'm a retired Army officer. Oh, I was got abruptly, I'm sorry. I'm a retired Army officer at the rank of the captain. And when Jcrc was going to start, I was selected. I was working with the General Military Hospital then, and I was sent. Actually, at that time, I was the admin of Mbuya Hospital, so I would be the one to clear some of the people going to Germany. But at the same time, a medical lab. So I was sent to learn doing some tests. Among them was the CD4 counting. So I met Professor Dietrich, and he talked to me at Hamburg.
You were trained there in Hamburg?
Yes. Then I came with an equipment by hand. It was a fluorescent microscope. So we created a dark room. It was like a photographing area. And I started that work. Then later on, when the machines came, it is called the flow cytometer. Actually, it is the defense that bought them. You know, because of that tri-party defense and Ministry of Health. So defense supported the buying of those equipment, and I was behind that plan.
Oh, okay, thank you so much. So you capture, thank you to Guinea. So therefore, write the story accurately so that you don't lose it. Because for me, you are lucky that I'm just here with my mobile computer on my head. I just remember everything from my head, but you know, you may forget some of the items. So I really thank Professor Dietrich. I don't remember whether we have ever given him a medal or anything. My people should check and recognize his contribution. Then I thank all the other people, partners who came, like USAID, like CDC, like PEPFAR, and all those groups. We thank them so much for their partnership. They have, God will remember them and give them some place in heaven. So I thank the scientists who are here, like the young lady who is from the university. That young lady, stand up and they see you. Come and tell us here what you are going to do. Come and tell us. Don't fear these Africans, they have no problem.
Oh, thank you, Your Excellency. I'm very honored. I'm Dr. Jennifer Adair from the Fred Hutchinson Cancer Center in Seattle and the University of Washington. I'm very grateful for...
I have been to Seattle, but I went to Boeing. I didn't come to your hospital. I went to Boeing, the aircraft.
Well, thank you for visiting. And very excited to have co-founded the Global Gene Therapy Initiative with Dr. Kitio. Having seen the example of Dr. Dietrich very early on, and remembering that it is very important for even new technologies such as gene therapies to be put in the hands of the people who need to bring them to their own populations. And so, with this in mind, Dr. Kitio and I founded the Global Gene Therapy Initiative to create a team of experts who could guide Uganda to lead as they led in the HIV epidemic.
How do you like Uganda?
I love Uganda.
Have you been here before?
I have.
Okay. Thank you so much.
Thank you.
So we are here to celebrate I hope you will celebrate without alcohol. I hope you will just eat pork and all those things. Although Wanyankole don't eat pork, the traditional Wanyankole, but I hear the ones of these days have finished all the pork in Kampala. So I congratulate you and wish you good luck. Thank you very much.
Your Excellency, we won't keep you too long from here now. We will have the anthems very shortly, so may we all be upstanding. And as we stand, can we give His Excellency a thunderous applause for gracing this 30th celebration and for supporting the sciences. And the Bazukuru, I'm sure you're very grateful, especially the SACCO members. Bana isauli de karuka SACCO. We'll have the UPDF brass band with the anthems, please. Your Excellency, we only have one ask. We have some photos, and I will invite the first category, which is, please take your seats, ladies and gentlemen. I will invite the very first category, which is the board members. If you could make your way down and prepare, but I'll invite the Honorable Minister and the PS to join them. So please make your way, board members, including, of course, the Executive Director of the Jcrc. And then the next category will be management. The Jcrc management, you will take the second photo. So again, go closer. we will not have so much time. And finally, may I request these partners to join in the last and third photo. That will be our partners, of course, Jennifer, who is here, Dr. Jennifer, Professor John Yo, and a representative from the three founding institutions, Makerere, UPDF, and of course the PS will represent the Ministry of Health. So our partners, the management team, and the board, those are the three categories. All right, so we will have only those categories, and I've invited our colleagues and partners, and as you make your way, there will be a mask provided for that photo. And as we do that, I'll ask the brass band to give us some little instrumental music in the background as we await our chief guest to join in the photos. And immediately after that, we will transition to Bantu, who will lead us into entertainment to kickstart the after party for the staff of Jcrc. The management team members who are supposed to be joining. All right, okay. So the last one. This is management. So we're joining on. The founding partners, the UPDF, Makerere, and the ministry, which are represented. We'll have the senior management team. I hope you're very close. Senior management team. Aisha, we have the senior management team, if they can get closer. All right. So that's the senior management team. Then we have the founding partners and, of course, the board members. All right, so we will now have our very first photo. The board members of the Jcrc. That's our very, very first photo, and the next is the partners. Next is the partners. Can the partners join? The board members can leave. The board members, we will only have a representative of the UPDF and a representative of the ministry remaining. So, Major General, you have to stay. And that is our very final photo. We apologize to the management team for the miscommunication. We thank you, Your Excellency, once again. Can we give His Excellency the President another round of applause? Bantu, this is for you. So Bantu, if you can send a representative. Please continue, Bantu, entertain the President. Thank you very much. Bantu, Honorable Minister, you will make your way straight to the cake. You're cutting the cake for us. Dr. Sisi, can you join the Honorable Minister? Let us cut this cake and celebrate these 30 years. The team that is in charge of our cake, can you make your way? Honorable Minister, that will mark the very first highlight of the after party that the President has guided in terms of the beverages that will be served. So HR, I hope HR Manager, you're aware on the guidance of the Principal. And we shall be monitoring on social media. All right, so I want to request the Honourable Minister, the PS, the Board Chair and the Executive Director and the team, if we can immediately allow for the Honourable Minister to cut this beautiful cake that is representing our administration block. Honourable Minister, I don't know whether you start with the foundation or the roof. The roof, okay. We will start with the roof, okay. So when you're ready, Honourable Minister, I'll count you from 5. I'll count you down from 5, okay. Brass band, some little entertainment as we do this and prepare for this. We have, you know, cake has protocol and there are standing orders around cake. There's things you must do when you're going to cut cake, and so that is what is being undertaken. And very shortly we will cut this cake. We want to thank Bantu Cultural Troupe and the brass band for entertaining us. Very shortly we will transition into the very formal after party. I want to invite our guests to lunch. We will be having lunch served here, so do not leave without lunch. And members of the press, you will of course have to organize yourselves very quickly to interview the Executive Director immediately after that cutting of the cake ceremony. We want to appreciate all the partners, the Ministry of Health, the UPDF, and of course our key stakeholders, the academia and Makerere. And shortly we will cut the cake to celebrate 30 years of research and innovation. So 5, 4, 3, 2, 1. Big round of applause, ladies and gentlemen. Thank you very much, Honourable Minister. You can take your seat. We will be ushering you, ladies and gentlemen, to lunch. And do stay with us. The after party starts now, and of course we'll transition to our entertainment for the evening. We'll allow the UPDF brass band entertain us and then transition to the formal entertainment from Bantu Cultural Troupe and our in-house DJ. We want to thank the organizing committee who have been steering the celebrations here at the facility and for preparing this grand event. So we want to thank you very much, and I will allow for the media to handle the interviews as we listen to the brass band.
Ladies and gentlemen, lunch is going to be served very shortly. I humbly request we stay. The ushers will guide you to lunch. Ushers, please guide to lunch, our guests to lunch, and show them where to go. Ushers, please guide our guests to lunch and show them where to go and where to pass. Thank you very much.